Here are 5 missed reasons why you can't get pregnant, and it gets lazily labeled as unexplained infertility. But to me, that's just a name for that the standard workup didn't find an obvious problem, not that there isn't one. Number 1 on the list, that you are ovulating, but it's a weak ovulation. And then we have to have a look at your thyroid health, iron, ferritin, blood sugar. If they are all off, you might not be able to release an egg, and then you might not be able to get good progesterone output, and you need that to build a sticky, calm lining. Number 2 is insulin resistance, and that can hide literally in plain sight. You don't need diabetes for insulin to mess with ovulation and the quality of your eggs and cause inflammation on top of this. But fasting insulin is often the missing data point. Then we have number 3, silent endometriosis or inflammatory pelvis. You can have endo with normal scans and still have an inflamed, hostile implantation environment, and doctors don't often check. Anyway, number 4 is sperm DNA fragmentation. Now, when you go to the office, they do a semen analysis, and that can come back totally normal, while the DNA quality is the actual issue, especially when you have oxidative stress, age, too much alcohol, or metabolic issues. Number 5 on the list is that you might have uterine or tubal factors that weren't probably ruled out. Polyps, fibroids, adhesions, scar tissue, subtle tubal issues, or chronic endometriosis that can all block implantation even when hormones look totally fine. And well, here's a bonus point, number 6 probably, and I'm seeing this right now in a member in my fertility circle. She's got massive blood flow issues. Her symptoms scream circulation, amongst other things. When it comes to blood flow issues, we definitely have to look at post-viral vascular changes, including after COVID. Now, that is being actively studied at the moment with evidence that endothelial dysfunction and impaired perfusion can persist in some. I'm not saying COVID caused you infertility, but I'm saying that blood flow and oxygen delivery matter for your ovaries, lining, and implantation. And when that virus actually hit you hard, that might be the problem. If you are done being told everything looks normal while nothing is happening, that's exactly what I do inside my fertility circle. I stop you there guessing, and we find together the missing levers, and we build the conditions for you to get pregnant and stay pregnant.